Hello, everyone. We're Group 18, Jeanette, Jonathan, Brooklyn, Spencer, and Joseph. And today we will be discussing Cushing syndrome. A 50-year-old female goes to the doctor complaining of fatigue, irritability, and muscle weakness. The doctors notice that the patient has high blood pressure, which has not been documented before. The patient also is showing weight gain around the midsection, but muscle loss around her arms and legs. The patient has been given cortisone, a corticosteroid, for her arthritis. The patient is first given a 24-hour urine test to monitor her cortisol levels. When the levels came back high after 24 hours, the patient was then given a low-dose dexamethasone test. And after the 3-day period, the patient's cortisol levels were still high. It was suspected that the patient has an exogenous Cushing syndrome caused by the use of the cortisone. The doctor began to wean the patient off of the cortisone and monitor the patient for her cortisol levels, while working to help the patient lower her blood pressure and watch for any more weight gain or muscle loss.
This patient had Cushing syndrome, a disorder characterized by exposure to high cortisol levels over long periods of time. Cortisol is the hormone that creates a chronic stress response throughout the body. The disorder is named after Dr. Harvey Cushing, a neurosurgeon who first described it in a patient he had with hypercortisolism in 1912. For over 40 years, the etiology or cause of the disease was disputed. In 1933, they did the first neurosurgery on a patient with Cushing's disease.
The symptoms of Cushing syndrome. The clinical presentation of Cushing syndrome varies from patient to patient, in part related to the extent and duration of cortisol excess. Some of the more common symptoms include decreased libido, obesity and weight gain, plethora, a rounded face, menstrual changes in women, hirsutism, hypertension, ecchymosis, lethargy and depression, formation of a dorsal fat pad, and abnormal glucose tolerance. Now, some of the less common symptoms include EKG abnormalities and arteriolosclerosis, striae, edema, proximal muscle weakness, osteopenia or fractures, headaches, backaches, recurrent infections, abdominal pain, acne, and female balding. Incidence of Cushing syndrome. It is generally recognized that Cushing syndrome is an uncommon disorder. There have been few studies done to estimate in detail its incidence, and there has been no population-based survey reported on Cushing syndrome. It is estimated that about 10 to 15 million people are affected every year by Cushing syndrome. Pituitary adenomas, aka Cushing's disease, account for more than 70% of cases in adults and about 60 to 70% of the cases in children and adolescents. Cushing syndrome most commonly affects adults ages 20 to 50 and is more prevalent in females, which account for about 70% of all cases.
There are two main risk factors in the development of Cushing syndrome, one of them being corticosteroid use. Corticosteroids are steroids used to treat inflammatory diseases like lupus, asthma, or rheumatoid arthritis. This type of drug is also used for patients who are receiving transplanted organs to help avoid organ rejection. Tumors of the adrenal gland, as well as adrenal gland abnormalities, can cause high amounts of cortisol production. Tumors of the pituitary gland can cause a release of too much adrenocorticotropic hormone, which then in turn stimulates the production of cortisol in the adrenal gland. Ectopic tumors are also a risk factor, and these tumors are any kind of tumor that is located outside the pituitary gland that can also produce adrenocorticotropic hormone. These tumors usually occur in the thalamus, thyroid gland, pancreas, or lungs. High stress levels can also increase your likelihood of developing Cushing syndrome, and these can be caused by work, chronic illnesses, injury, or even pregnancy. Anything that puts excess stress on the body can increase cortisol levels. Cushing syndrome is not an inheritable disease or syndrome, but in cases where someone has a family member who has developed Cushing syndrome, the likelihood of them also developing Cushing's syndrome is higher because they also might have risk factors in their life. Other risk factors include malnourishment or certain lifestyles like alcoholism or high amounts of athletic training. Depression, panic attacks caused by panic disorder, and anxiety disorders are also a factor, as well as being a female of reproductive age. Cushing syndrome is the inflammation of the body that is caused by excess cortisol levels produced in the adrenal gland. Cushing's disease is responsible for 2/3 of Cushing's syndrome cases. Cushing's disease is caused when the hypothalamus releases too much corticotropin releasing hormone that travels to the anterior pituitary gland. This stimulates the release of adrenocorticotropic hormone. Adrenocorticotropic hormone then travels to the adrenal gland to begin the production of cortisol. This has a negative feedback loop from cortisol to the hypothalamus.
Now I'm going to talk about the diagnosis. If the patient has multiple progressive symptoms of Cushing syndrome and any exogenous causes, like the use of synthetic hormones, have been ruled out, diagnostic testing is performed to confirm the diagnosis. The goal of these tests is to confirm the presence of endogenous hypercortisolism, which is a high level of cortisol in the body. Since no test is 100% accurate, the guidelines for a diagnosis of Cushing syndrome suggest verification by more than one of the 3 screening tests. The late-night salivary cortisol test relies on the normal fluctuation of cortisol levels throughout the day. Generally, cortisol levels peak in the morning, decline throughout the day, and reach their lowest at midnight. This test measures the amount of cortisol in the patient's saliva at midnight. High levels would be indicative of Cushing syndrome. Instead of measuring the cortisol levels at a specific point in the day, the 24-hour urine-free cortisol test measures the total amount of cortisol excreted in urine over a 24-hour period. High cortisol levels in the urine would be indicative of Cushing syndrome. Dexamethasone is a compound that lowers cortisol levels by inhibiting adrenocorticotropic hormone, or ACTH, release. The low-dose dexamethasone test takes advantage of this. Urine is collected for 3 days, and on day 2, a low dose of dexamethasone is administered every 6 hours for 48 hours. In a normal case, cortisol levels should drop after the use of dexamethasone. If cortisol levels remain high, a diagnosis of Cushing syndrome is likely. Once a diagnosis of Cushing syndrome has been confirmed, imaging is usually conducted to determine the cause. A common cause is an ACTH, or adrenocorticotropic hormone-dependent pituitary adenoma. This is a tumor of the pituitary gland that secretes too much adrenocorticotropic hormone, which you can see in Figure 1. Another common cause is an adrenal tumor that secretes too much cortisol. As a result, you would call this ACTH independent, which you can see in Figure 2. Both of these can be found using magnetic resonance imaging, or MRI.
The prognosis for those affected by Cushing syndrome. For those who are affected, you can usually expect rounded faces or moon face, easy bruising, weakness, and fatigue as general onset symptoms. Without treatment, those diagnosed with Cushing syndrome can expect a 50% mortality rate within about 5 years. Deaths are usually due to comorbidities that occur because of Cushing syndrome. Usually obesity, diabetes, heart disease, hypertension, and fractures from osteoporosis. That being said, with proper treatment and management, those with Cushing syndrome can expect a normal lifespan. Treatment and therapy for those who are affected by Cushing syndrome. When caused by a iatrogenic means, the best treatment is to wean the patient off of the exogenous steroids, which cause the condition, over the course of several months. If you were to take them off all at once, the adrenal glands would not function properly and would only lead to further pathologies. In the case of an endogenous Cushing syndrome caused by a tumor of the adrenal tissue specifically, surgical intervention is the generally recommended approach. If the tumor of the adrenal tissue can be fully removed, the patient will come down from Cushing syndrome and basically be cured. when the pituitary gland is subject to a tumor that is producing large amounts of adrenocorticopic hormone, that tumor can also be removed via surgical intervention, although it is at a higher risk and is not done as often as when it is an adrenal tissue tumor. And again, if you can fully remove the tumor of the pituitary gland, then you will also see full recovery from Cushing syndrome. Either way, if the tumor cannot be removed, several drugs that target the problem hormone pathway can be used. These include mifepristone, which blocks the glucocorticoid receptor physically, parasitotide, which is a somatostatin mimic, which will lower the amount of adrenocorticotropic hormone production, and cabergoline, which is also antagonist to adrenocorticotropic hormone production, as well as most other hormone production in the pituitary gland. While these drugs have been prescribed for treatment, they are generally not recommended due to their pretty bad side effects, including diabetes, obesity, and in the case of cabergoline, loss of further hormones can lead to other pathologies, which are obviously not preferable.
Here are some interesting facts about Cushing syndrome. Most patients are diagnosed at 30 years old, with the majority being between the ages 20 and 50. It is more common within women, but more severe cases are seen within men. However, before puberty, the ratio between female to male cases is similar, at about 1:1. The average age of diagnosis in pediatric cases is 13 years old. Some patients may only exhibit psychiatric effects like depression and anxiety, or neurocognitive effects like learning and memory. Surgical removal of pituitary adenomas has less than a 2% mortality rate. Since 2010, surgical treatment has shown remission rates of 65% to 85% and recurrence rates of 10 to 35%. The sooner you begin treatment, the better the expected outcome. Here's a list of the sources used for this presentation.